Welcome. Thank you for joining Consumers Doctors channel. I was going through the changes, what's going to happen in healthcare. I was looking at President Biden's manifesto. If he's going to be our next president, we need to look at healthcare manifesto. On healthcare issues, I was looking at the healthcare manifesto. They want to have healthcare access for all Americans. Yes, we all want healthcare access for all Americans. I agree with that statement perfectly. But how you do it, it's a different thing. How you achieve the healthcare access of, when I look at it, it says affordable healthcare for all Americans. Yes, we are all talking about everything is the same, but how do you achieve it? That's where I am an independent. I used to be a Democrat. Democratic Party left me. They're not addressing my concerns. I I believe in freedom. I believe in freedom in healthcare. I believe Americans are in shackles of healthcare, and they want to put more shackles in healthcare by bringing a public option, folks, which I can't fathom. Americans going to be more in shackles with healthcare rules and regulations, and it's all already there. Healthcare industry has been so dysfunctional right from the get-go. It's been so dysfunctional in this country. We are spending $3.8 trillion and we can't even get the right care. And there are still 28 million Americans without insurance and additional 15-20 million illegal Americans, no insurance. How do you solve it? Not by the public option. Come on. Being an independent, I'm just telling you. Chicago mayor he set up a beautiful example. He's a close friend of, he's a chief of staff for Obama. He embraced the concept of public-private partnership. Public-private partnership. That's the beauty. We can do the same thing in healthcare by bringing public-private partnership. When I was looking at that manifesto, I said, public option, affordable care, guaranteed coverage. We all love these statements, but I don't see where this public option will lead us. This healthcare has been such a contentious issue. Contentious all the way through. And that Obamacare, so-called Affordable Care Act, was passed by not a majority. Just one man, one dead senator made the difference. Edward Kennedy. He made the difference. He is the one who, he basically, that's what they manipulated a bunch of folks in the Senate and they passed that legislation. And we are still having the same issues over and over. Every time we talk to these representatives, they bring about issue of public option. Why can't we embrace on public-private partnership? Yes, public-private partnership, it gives solutions to all the folks. When they say about public option, only thing I think quite a bit about public option. Basically, they want to control you. Why do I say that? I'll tell you why. If you go to any urban areas, If you go to any city, county, tell me, they're all working for the government. They're all trapped in that system, folks. They're trapped in that same nightmare, public option coverage. That's why this this Democrats wants to control city employees, county employees, public workers. That's why they bring this public option. That's what they keep saying, public option, because they want to make this into a public fiasco, so-called public fiasco. Why can't we embrace public-private partnership, which will achieve the same thing? How? You may ask me how. Okay, I'll tell you how. There are 160 million Americans on private insurance. You can change that also. 100 private insurance. And it's all employer subsidized. And another 60 to 65 million on Medicare. Another, I would say 65, 70 million. And another 20 million on small companies have providing the care. So we have an issue with 28 million uninsured and 20 million, 15, 20 million illegals. We can address all that by a public-private partnership. When you say, what is this public-private partnership you're talking about? I'll tell you how. You form a health review board. Health review board made up of public-private partnership. Yes, and it doesn't cost the government a penny. It is not burdening anyone. When you do that, you're involving the unions, you're involving private businesses, you're involving, all these companies, Wall Street, you're involving everybody. And you form a board, health review board. You can have 15, 20 members made up of health review board. Their job is to provide access to healthcare. How do you do it? Okay, their basic role of the health review board is to provide insurance for uninsured or impaired group or economically they cannot afford it. People who have mental illness, people who cannot take care of themselves. If there's one family member have a mental illness, it doesn't need to affect the whole family. Health review board looks at individual applicant and he gives a certificate of guaranteed coverage. When you get a certificate of guaranteed coverage, insurance companies will love to take care of those people as a private insurance. How about that? As a private insurance. Health review board, once it gives a certificate of guaranteed coverage to all these people who deserve it, I'm not denying anyone, give them the certificate of guaranteed coverage. People really need it. And go out there and get a private insurance, folks. You can see your own doctor. You can go wherever you want. And meanwhile, the insurance companies needs to wake up, man. These insurance companies are not doing you any favor. They're all lobbying heavily, because what I'm going to propose is invest in Americans, folks. Invest in Americans. That money, what you want to put it back in the pockets of the Americans. What I'm telling you is, have everyone eligible for health disclosure, healthy premium accounts, so-called HDHP accounts. Health disclosure, healthy premium accounts. When you have that, when you have health disclosure, healthy premium accounts, what will happen is their premiums are lowered by 60%. HD accounts are basically what it is, they're deductible. Oh, people don't have They can't pay for the deductible. Listen, I'm talking about not initially all these 160 million who are employed. Government doesn't need to bother because employers will take care of that deductible portion. Everybody will have HDHP, which is mandated for all Americans to have HDHP, health disclosure, healthy premium accounts. Once you have that set up, once the premiums are lowered, in that same contribution, you should, whatever you're saving money for the lower premium, put that money into your pocket. What it does is into the Health Solutions Advantage, which is an HSA. Actually, I would like to see a mandate set aside by these, representatives in Congress and Senate. They need to mandate everybody should have a Health Solutions Advantage account. So what it will do is everybody will have an HSA account, and I'm pretty sure a lot of people don't want to use because this is their account. They have the money. As an individual, you can put money aside, $300 per month, which will come to $3,600. By the year end, it'll be $4,000 sitting in your bank, ready to be used for your healthcare expenses, for whatever your deductible, because you're covered by the insurance after the deductible is done. So you're basically protected by these HDHP accounts for catastrophic illness, for major medical coverage, and you're also protected for guaranteed health insurance. You're also protected with a pre-existing. So the issue of pre-existing coverage doesn't even arise. Why can't we do this public-private partnership for all the folks instead of putting a public option? Public option, what you're doing is basically they want to be public servants. By enrolling this public option, basically they want to be like a city employee or county employee. They want to control these guys. That's what the Democratic Party is looking for. Control them through public option. That's so sneaky way of doing it. I'm telling you, there's such a sneaky way of adopting. They want to do the environmental, they say they're all for the environment. Yes, why don't you do it in the same way, public-private partnership? Why do you have to bring it from top down and make everybody feel your rules and regulations? Why didn't you get involved with the public-private partnership in the environmental issues? Yes, we all want environmental to be clean and healthy. We want clean water, clean air. Everybody wants that. But make it as this EPA, man, EPA is nothing but, it looks like, again, I don't want to say this. EPA is nothing but left wingers. We need to stay in the center. This country needs to go ahead, and we need to govern from the center. I don't know if you guys are listening. This country will progress through the center. You don't need to be right. You don't need to be left. You need to take care from the center. Everybody says it, but nobody does a damn thing about it. Everybody says, just embrace public-private partnership, which is from the middle. It is not costing the government. It is not taxing anybody. It is not taxing anyone. Through a public-private partnership. Whatever the health issues you want to talk about, let's do a public-private partnership. That's the way to go. That's a health. You want to bring the public option, make it into public-private, not just only public. Why only public? Because they want to control these guys. That's the only sneaky way of controlling people. Like they're controlling the city employees, county employees. Have you seen all the city, county employees? Very first thing they do is they justify their job. They give you more to do. Have you noticed that? They give you more to do because they're justifying their position, and they're all voting Democratic. Yes, I have no problem with that. But in the benefit of the Americans, We need to make it into. Actually, I would like to see city and county employees under the public private, not completely under the control. They have to be independent. They have to be. Why can't we run the country from the center? Why do we have to be extremists? Why do you have to be in either this side or that side? And we are electing these representatives to run this country, not to make for the public safety. Healthcare industry, there's too much regulations, too much. Hospitals are losing money. Hospitals are providing uncompensated care. They're doing the government job, man. They are doing the government job because government failed to provide insurance coverage, have a certificate of guarantee, and hospitals are bearing the burden. Doctors are doing the same thing. And so-called this Medicaid is useless. Medicaid needs to be scrapped completely. Medicaid, Medi-Cal, so-called this, the public option, they need to be scrapped. I would rather, even that Medicare, the money they're putting into the intermediaries, I would rather have this Medicare money given it to me. I can handle my own healthcare. I don't need somebody telling me where to go, what to do, which drug to buy. Come on, you don't need all that. He just give me that $1,200 instead of putting the money in those intermediary organizations. Very first thing, all these intermediate, I'm talking including Kaiser, because what they do is they take your money, you're signing a paper, you're giving up your rights, they take your money. Very first thing is they put all these clauses. You can't do this, you can't do that, you have to pay $15 copay, $20 copay, deductibles, and restriction in coverage. You cannot see this doctor, you cannot have this surgery, denials. This is what happens once you have a public option. Bring public private into the fold, man. People who are listening, public private, Rahm Emanuel, Chicago mayor. I've been talking about Rahm Emanuel. The guy is really, I like him. He's an Obama chief of staff, or he's close to Obama. I like him. He ventured into the public-private partnership in Chicago. He made a lot of changes, and I would like to see the same thing nationally, embracing public-private partnership in healthcare, in environment, you name it. Why just make it into public? Because they just want to control. Right now, the city employees, all the urban employees are under the cloud of this Democratic Party. That's what they're doing. They want to, and look at these elections. It's the way they have conducted their elections in the cities is pathetic. It's pathetic. They go and get signatures from the dead people. They go and get the signatures from people. They don't want to even sign it. They go to the nursing homes and have them sign these papers. This is not the way to run this country. You cannot tell people, oh, just vote here, sign here, and collect all the signatures and put it in the ballot. Come on. We can't do that. There is a legality, folks. I don't know what the Supreme Court is going to do, but what they're doing is wrong. The way they're collecting ballots and mail-in ballots, the way they are not even mail-in, they're collecting everybody's and they're mailing in bulk. You can't do that. You have to be present, or even if you want to vote, fine. Absentee ballot, but absentee ballots are all scrutinized. Not this, because of the COVID. We are in this mess because of the COVID. Healthcare needs to be straightened up. Healthcare needs to have a public-private partnership. We need to have a health review board. We don't need public option telling us, oh, you can see this doctor, and your premiums keeps going up. For the rest of the folks, I'm talking about people who are paying the insurance, because every time people switch to the public option, it strains on the private insurance. Their insurance goes up. That's what happened under Obamacare. We can't do that. This is all, we are, our country is based on fundamental principles of free market. You want to change this country forever? Come on, folks. Guys, if you're listening, hey, I am an independent. I'm sure these independents in the middle, they decide the election. They are the one control. They are the one who decide which way. They are straightforward thinkers. They know what they're doing. They decide there. Not the left, not the right. People in the middle are looking forward to the better outcome of this chaotic elections. Hey guys, if you like this channel, subscribe, share, and hit that bell. I want to hear comments from you guys, and we'll see you tomorrow. So this is Consumers Doctor from Foremost Organization, and it's a public service organization. We want to educate the people on healthcare. My focus is on healthcare, how to achieve freedom in healthcare and free people from all the shackles of healthcare. Right now, we are in shackles from, you may call it, from insurance companies. We are not free, folks. Insurance companies are telling us what to do. Consumers, I want to be in the driver's seat. My dream is consumers need to be free. They need to be transparent. They should be shopping like home insurance, auto insurance, for lower premiums through health disclosure, healthy premium, healthy pricing, whatever you want to call it, and put money aside into health solutions advantage. An individual can put money aside $8,000 to $10,000 every year. A family of 4 can put in $70,000 to $80,000 every year. I'm not kidding. And that goes a long way, folks. 10 years from now, you will have individual will have $30,000, and family will have, I'm not kidding, $80,000 to $100,000, because you're compounding, because it's tied to the index funds and they're not taxed, and you can withdraw the money anytime for your health care. You can shop for your insurance, you can shop for your doctor, you can shop and get the best care what you need. This is an asset, folks. This is an asset. Protect your asset. I'm begging you, protect your asset and embrace health disclosure, healthy premium, HDHP, and health solutions advantage, which is an HSA. Bye. Thank you.